So it is 9 o'clock, Thursday, May 28th. Now I'll call the meeting of the Humboldt County Board of Health to order. First thing they'll do is have a roll call. And Dr. Stringham?
Yes, here.
Sheriff Allen?
I am here. Good morning.
Commissioner Bell?
I am here.
Commissioner French?
I'm here.
Commissioner Brizenden?
Here.
And I'm here, and Commissioner Cherry is not with us today. So. Next, Pledge of Allegiance. Okay, if you join me in the pledge, please. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. We'll go to public comment. And once again, remember, if your mic is closed, it's *6 to turn it on, *6 to turn it off. And if you have public comment, please state your name for the record, and we'll take any public comment at this time. Is there any public comment? Okay, we'll have another chance for public comment at the end of the meeting. So we'll move on to our update from the public health official, Dr. Stringham. Presentation by Dr. Charles Stringham, Public Health Officer, Captain Sean Wilkin, Humboldt County Sheriff's Office and Local Emergency Manager, and Nicole Maher, Public Information Officer, regarding the current status of the Humboldt County response to the COVID-19 virus, including but not limited to the latest number of positive cases in the county, as well as updates regarding other efforts to mitigate the spread of the virus. I'll turn it over to you, Dr. Stringham.
Thank you. It's good morning, everybody, and very excited about some of the data that I'm going to be able to share with you this morning. So essentially, the news that we have here is very impressive. Really, can everybody hear me, by the way? I'm having some feedback in my mic, I think.
Yeah, there is feedback, but I'm not sure it's you. Or maybe it is.
Yeah, what I'll do is, Dr. Stringham, hang on a second here. I'm going to mute everybody, and then if you'll just join back in by unmuting your mic, I think that might solve it. Now, if you can go ahead and unmute your mic, I think you're there. Go ahead and give it a shot.
Okay, perfect. Sound quality okay?
Perfect.
Okay, excellent, excellent. Well, the news I have to share this morning is very exciting. We've all been looking forward to hearing these words for the weeks that we've been dealing with this virus. We only have one new case to report for this week. So we've gone from 77 cases to 78 cases. And what I'd like to be able to do is discuss a couple of other things. One is that Humboldt General Hospital has had no hospitalizations for a 3-week interval. We're very pleased about that. The auxiliary hospital was demobilized, and there are just a lot of different things that are going on here that are absolutely fantastic news. I'm very, very happy. I know everybody else is too. And what I'd like to do is spend a little bit more talking about the hows and the whys, as opposed to just the numbers, because the numbers are fantastic to be able to say, but those numbers represent a tremendous amount of hard work done by our community, done by citizens, done by people who've wanted to do various things and have not done those things, get-togethers, parties, gatherings, all kinds of different things that people have made many, many concessions throughout Humboldt County for the last 2 months, and things have really paid off. So I'd like to dedicate this presentation this morning to the people of Humboldt County, to everybody who's been a part of making this very wonderful thing happen in our community. Next, I'd like to talk a little bit about the various things that I'm hoping each of us will take away from this, because the reason these things have happened isn't because of happenstance. these things have happened because people have been doing the right things. And as we enter phase 2, these things that we've been doing are going to become even more important. I'd like to draw a parallel between other life transitions and this transition as we go from phase 1 business reopenings to phase 2, because there are potentials for a lot of different dangers. And if we do things the right way, if we continue to act the way that we've been acting, then we should be just fine. We can take the power and the authority for each one of us, and each one of us has the ability to change the outcome in this situation. And as long as every single person continues to do those right things, then we should be just fine during this next phase. There are a few different critical issues and liberties that we're going to gain as we enter phase 2. One of them is that the governor's guidelines for gatherings of 10 people is going to go to gatherings of 50 people. What that means is that groups up to 50 will now be able to come together and still be in compliance with the governor's guidelines for groups and gatherings. There's a big difference between 10 and 50, and our behavior is going to become even more important in this next stage of the process. So I'd like to invite everybody to continue doing all of the things that each of us are doing now and making sure that the right things continue to happen. Mostly, I'd like to just explain that the reason that these things happened is because of everybody watching this event this morning, this meeting, and it's important that everybody realize that you've all had a hand in doing this. I think Humboldt County leadership, everybody really appreciates the efforts that have happened and the right things have happened. That's why we've realized this result. I'd like to transition to talking a little bit more about some of the things we talked about last week, and that is antibody testing, some of the specifics that will happen with the antibody testing and some of the proposals. We're still pretty much in the organization phase of this, but I want to unroll a couple of more details of exactly what this program should look like, in my opinion. First, the antibodies are important because it lets us know what percentage of our community has been exposed to this. It changes the lethality because the greater the number of people who've had this virus, when we learn that number, the less in terms of a percentage the number of people who've passed away would be. And that is a really good bit of news. So we're hoping that more people have been exposed to this than we think, but the data that we saw initially in the community-based program that was done through the community health nurse and the sheriff's office would seem to indicate that there aren't as many cases in Humboldt County as we had thought there were, that most of the cases have been accounted for in terms of the symptomatic folks who are already tested. So I've talked to Melissa Peaks, who's the state of Nevada's chief epidemiologist. I think she's very excited about the fact that Humboldt County is considering doing this. Other counties in the state have not done this yet, and there's a very specific reason why. First, I think the state is looking forward to guidance from the CDC, and the CDC is going to be able to give information about what these assessments for antibodies should look like. And to a certain extent, Humboldt County will be doing that before this set of recommendations becomes available from the CDC. There are a couple of advantages and disadvantages that we can discuss as well. But I think it's important that Humboldt County take a leadership role throughout the state, that we can provide data to the rest of the state earlier in the process. And I think that's the primary advantage to our moving forward with this. I have some specifics about the program. And so essentially the price for each one of the tests made available through LabCorp, which is one of the primary vendors of laboratory tests in Reno. Humboldt General Hospital uses them for a lot of reference laboratories, and our office uses them as well. Many offices do. And LabCorp, through the company, the manufacturing company is Roche. It's a major medical company. They make medications and various testing equipment, various other medical supplies. And we can do an IgG antibody test for $50 each. That price, I think, is a fantastic price, and it would make very cost-effective the process of being able to screen for antibodies in our community. IgG is the technical term for the antibody that gives long-lasting immunity after certain infections, and COVID-19 is no different in that respect. The downside to doing this is that it requires a blood draw. And so far, the community-based testing that the Public Health Nurse's Office and the state had offered, it was done through nasal swabs. It's a little bit easier to do that. And I think that when we invite people to participate in our program, the fact that there will be a blood draw as opposed to a nasal swab may make it a little bit less palatable for people to participate, but I have a plan for that as well. My plan would be that we move forward through the community-based paramedicine program, and that's Humboldt General Hospital's EMS service community paramedicine program. It's a program where paramedics and other emergency response technicians are doing blood draws for our community. So they would do a number of different things. They have a lot of different functions under ordinary circumstances. And in this case, they could serve as a way to be able to draw blood safely on people. So my recommendation would be that we start with about 0.5% of the population of Humboldt County, and that would be approximately 84 people. My assumption is that our county has approximately 16,800 people. That's the working number that we've been using through this process. And 0.5% would be 84 people. And it would give us the capacity to have a large enough sample that we could extrapolate forward to the total number of people who likely have been exposed to this virus in the community, but it would be a small enough number that it's still manageable. The larger the number, the more accurate the data, but the smaller the number, the less expensive and easier it is to do the study. So 0.5% is a number that I kind of came up with. I thought that would be reasonable. If we did 84 tests, we'd have a cost for laboratory testing of $4,200, and about $1,700 would be the price for the laboratory or for the blood drawing services provided through the community paramedicine program. It'd be a total of $5,900. So just under $6,000 to be able to get this data. We've looked into a number of different means by which to finance this, and or to potentially have it funded through an outside source. And my hope is that one of the local companies, or possibly a number of different companies, might get together with us to either notify my office if you have interest in assisting financially with this program, or Mr. Mendiola would be a good person to contact also. We're hoping that we can get some employers here in the community, some local companies, to help us with this, because this data will be very useful to all of us. Talk a little bit about the challenges that are associated with this. As I said previously, it involves a blood draw. So presumably some patients who are invited to join our study may not be interested. And I should digress for just a second and explain that one of the critical things in designing a study like this is that in order to be able to safely extrapolate out to all 16,800 people within the community, have to be able to truly choose people randomly. And the reason that's so critical is because if we don't choose people randomly, then when we extrapolate forward and look at the total number of people in the community who likely have this virus, it's likely going to skew that number in one direction or the other. I want to give you an example. Somebody, if 84 people are invited to join this study, presumably the people who don't want to join the study would likely not be as engaged as the people who do. And those people who are not as engaged are more likely to have not engaged in the recommendations we've made already, and therefore those people are more likely to be infected at higher rates. And so we don't want to skew the data, which is why it's so critical that we get good cooperation, and we'll put together a good program that kind of explains a lot of this to the folks who ultimately are chosen. But they'll be chosen from a broad cross-section of all people in Humboldt County that represent various ages and various genders, I guess 2 genders, and then also various other demographics in Humboldt County. I want to be able to do things that way. And so in terms of other critical things, the number is very small, and so the risk is that we may skew data in one direction or the other, and we're hoping to adjust for that. And we have various mechanisms that are probably beyond the scope of this discussion this morning, but experimental design parameters that we've looked at. So one of the other things that's very difficult is CDC is currently looking at the accuracy of some of these tests And I think one of the primary issues that I'm concerned about is I want to make sure that the study that we do has a good capacity to actually tell us what we want to be able to know. And so the sensitivity and specificity of these tests, meaning the test's ability to tell you that it really is positive when a person actually does have that virus, and that it's negative when a person does not actually have that virus, those specificities and sensitivities, according to what I've read on the Roche information, is in excess of 99% in both cases. So it seems to be a very good test. So we're excited about that. Still need to do a little bit of research to make sure that this is absolutely the correct test. Move on to another topic, and that is that we're learning more about the virus over the last couple of weeks. And CDC recommendations have changed a little bit, and I'd like to discuss one very specific thing, and that is when we release people from a respiratory isolation. And it's changed a bit over the last several months, and it's changed even over the last several weeks as well. So the initial strategies, as we discussed last time, was that initially we were not using tests to release people from respiratory isolation. The reason was because the tests were in relatively short supply. At this point, I recommend, and I'll talk about this here in just a couple of seconds, that we move back to a non-test-based isolation discontinuation strategy. What that means is kind of a mouthful, but what that means is that when we release people from respiratory isolation, these are cases in which people are known to have had this virus. They've had a positive test. The new recommendation that I'm proposing is that we go purely to a time-based strategy and no longer use testing. Here's the reason why. As we discussed a little bit last week, tests can sometimes be positive only in response to viral fragments. As this virus breaks up and a person's immune system takes over and knocks this virus out, there still are small fragments of that virus that remain in nasal secretions. So when you retest those people, they may show positive, and that doesn't necessarily mean that they're actually infectious. So it's critical that we move away from that testing strategy to purely a time-based strategy. The difficult part about that is that CDC has had a couple of different recommendations, and in fact just recently changed the most recent recommendation. Initially, CDC was saying people are no longer infectious after 7 days. Now they're saying that people are no longer infectious after 10 days. And more accurately, I should say that the CDC does not guarantee, they merely are pretty sure that people are no longer infectious after 10 days. Some agencies are recommending 11 days. We have been using a 14-day strategy with 2 consecutive tests done 24 hours apart. And so the way that this recommendation would change is we would just remove those 2 tests, but we would still require that people be in respiratory isolation for 14 days. And once a person has been isolated for 14 days from the time of onset of symptoms, then I feel confident that we can safely release them. The time we choose is a competition between a person's ability to get back out into the community and live their life, but also to consider public safety and the fact that we really don't want people infected by folks we've already known have been infectious. And I think 14 days is a very safe parameter. The requirement would be 14 days in respiratory isolation from the time of onset of symptoms, and in addition that the person have no additional symptoms whatsoever, not just that those symptoms are improving, but that the person have no symptoms at all. And that would be the new recommendation. I'd like to paint a picture of what I see the future looking like for us. And we've talked in the past, I think everybody's heard the concept of a flattened curve, that we were hoping to flatten the curve. I'd like to change your perspective of that, because I would recommend that we not flatten the curve. Recommend instead that we use a new strategy, and that is avoidance until vaccinated. And avoidance until vaccinated is a little bit different from flattening the curve. In the early days of this virus, the lethality rate, the percentage of people who passed away, was thought to be quite small. And a lot of the extrapolations that were used in order to determine what those lethality, those death rates were, assumed that more people had this virus than likely is going to be the case. One of the reasons I'd like to be able to do the antibody study is because it's going to help the people of Humboldt County to determine what exactly the lethality rate is here. And nationwide, that lethality rate may be as high as 6%. And this is the reason that we need to get good, hard data before we come up with a new strategy and a new way to see this virus. So my recommendation, avoidance until vaccinated, means that we continue to do all of the right things, that we continue to socially distance, continue to wear masks, and continue to wash our hands as we have in the past, and that we continue to do those things until a vaccination is available. For those people who choose not to be vaccinated, they will still have the benefits of others having been vaccinated, because of course, if the person who is going to infect us never gets the virus themselves because they're vaccinated, we enjoy an immunity too. That's a type of herd immunity. I'd like to again recommend that instead of the strategy flattening the curve, which accepts the fact that all of us will eventually be exposed to this, and I do not like that strategy. I think it's dangerous. So instead, avoidance until vaccinated is my recommendation. Continue to do the right things. So in closing, I'd like to explain one more time that the reason that things have gone so well in Humboldt County, and the reason that we're seeing this regression of the virus, that we are taking control, is because a lot of people have done the right things. For those people who are engaging and are part of the solution, this improvement, this benefit that we're seeing here, this wonderful result is dedicated to each one of you. And, thank you very much.
Thank you, Dr. Stringham. One question I had for you, it came from the call yesterday we had with the Governor's Leap Group, and it talked about testing on a monthly basis. And I don't know if this is a question for you or if Marcia's on, she could answer it. But they talked about testing with 2%, was it, a month for a year? And I just wondered how we were going to go about that.
Would that be a testing? Is that a PCR testing on the virus itself, or is it an antibody testing? I haven't seen that yet.
They said Marilyn Kilpatrick said there would be 50,000 people tested per month for a year, and 2% of the community per month for a year. So that'd be about 320 people tested here in Humboldt County per month. But I hadn't heard anything about that, and so I didn't know if you had. Is Marcia on today? Or
I think
Sean Wilkin, maybe?
I think it'd be an excellent idea, and I haven't heard that specifically yet. But if they're going to be doing that, I'd love to be able to see the data. I think it'll help to steer us.
And Commissioner Gibson, on that topic, none of the information passed down from state of Nevada in the last week has included any information or a plan for that. Okay. So I haven't received any of that from DEM or from the state as of now.
All right, thank you. The other question I had for you, Dr. Stringham, was from last week's meeting. When we do this random antibody test, will there be tests available through the hospital for someone that isn't in the random testing that wants to find out if they have the antibody?
Absolutely. So we've always had the capacity to test people for the antibody since very early in the process, and the antibody tests are much more accurate now. So yes, Humboldt General Hospital would still be able to test people who don't necessarily want to be involved in the study, because of course to be involved in the study we have to actually invite people in order to randomize things. But yes, Humboldt General Hospital would be happy to do that.
Are there any other questions of Dr. Stringham from any of the board members?
Mr. Chairman, this is Commissioner French. I had one quick question.
Go ahead.
Dr. Stringham, I was wondering when you were talking about the false positives and the viral fragments, the proteins that they're actually looking for within the tests and whatnot, is that data the data that was released recently by South Korea, or is there another study that they're citing for that as well?
It's yes, in fact, the data that was released by South Korea, it's very interesting. Part of the part of that data was actually incorporated into the presentation that I gave this morning. The mechanism that was proposed by South Korea and some of the other various centers that are working on this absolutely was that viral RNA, the genetic material incorporated into this virus, is actually what they're picking up on the tests. And as the viral fragments break up and they're no longer complete and able to infect a person, that they're still capable of making the test positive, of turning a positive result. But the assumption in the past has been that if we see viral content, that means that equates to the virus having the capacity to actually give that syndrome to infect a person. But in fact, the assumption that you made is correct, that it is not capable of infecting people, merely viral fragments.
Thank you, Dr. Stringham. Just a little bit of a follow-up on that then. So the CDC's comments relative to asymptomatic infection, or those people who are theoretically infectious that have no symptoms, is that going to skew that data relative to that study having to do with RNA fragments?
I don't think so. I think they're essentially two different issues as I understand it. So the first is that the non-symptomatic patients, the people who have the virus and are capable of spreading it, but never develop any symptoms, the difficult part about that is that we never know who those people are. And the Korean data gave a very, very wide band of the number of people who likely are asymptomatic. And the band was so wide that it essentially had very little relevance. I looked for other data. There's a Wake Forest study that will be coming out in its initial phases here over the next couple of weeks. 15,000 people, and I think it'll demonstrate those people who are asymptomatic a little bit better. But when we talk about viral particles and where the capacity to infect stops, but where the test is still positive, to me, that really speaks to the issue of releasing people from respiratory isolation based on testing rather than symptomatic versus non-symptomatic people who can infect us.
Great. Thank you, Dr. Stringham.
Thank you.
Mr. Chairman, this is Commissioner Brissenden. Dr. Stringham, how soon will you be notifying the 84 folks?
I would say that's going to happen at some point during about the next 1.5 to 2 weeks. There are still a couple of different things that we're trying to finalize in terms of what this project will look like. And I've also promised Melissa Peaks, the state epidemiologist, that we will share our protocol with her before we actually do this, because I'd like to give her the capacity to make recommendations and changes so that this data can be more broadly applicable and will be of use to the other 16 counties in Nevada.
Okay, I thank you. And they definitely have the antibody testing at the hospital now for anybody that may want to do it. And what I'm kind of thinking is folks may want to wait until they see if they're part of that 85 test cases before they go into the hospital for that antibody testing.
I would say that if a person really wants to know now, that the testing is done, that the collections are collected, the samples are collected at Humboldt General Hospital. So Humboldt General would do, it's called a send out reference laboratory. And so Humboldt General is able to collect those data through the order of a physician. And so it have to be ordered by a doctor. And then Humboldt General would collect the laboratories and send them out to an outside reference laboratory, either Quest or LabCorp or at the other places. So Humboldt General does a lot of lab testing there in-house, but this is one of the tests that I don't believe they're able to do as yet. At least that's my understanding.
Okay, thank you.
A real quick follow-up on that before we move off of it. Dr. Stringham, is it your understanding then that those people who voluntarily go in for a antibody test at Humboldt General, will they enjoy the $50 per test fee that we have negotiated, or is that going to be that fee going to be something different than that?
Well, we do a lot of business with LabCorp, and they've given us a very good price on this. I don't know what price Humboldt General would pay, and so I know that I could certainly ask some of the officials at Humboldt General to find out what the price is if a person goes spontaneously to the hospital and through with a physician's order and gets that lab test. In fact, if you'd like, I can tell you next meeting what the price would be at Humboldt General Hospital.
That'd be very useful. I'm sure that question will come up. Thank you.
Thank you.
Any other questions from Dr. Stringham? Commissioner Bell, or do you have a question?
Can you hear me?
Yes.
Oh, okay. Yeah, I just, only thing I was curious on, Dr. String, was where the database is coming from that you're going to pull the names out of the hat from.
Yeah, that's an excellent question. There are a couple of different specific plans that we have so far. So the first is I'd like to randomize the way that we get our data. And so we potentially would use voter registration and various other techniques, perhaps school rosters. I want to make sure that all of these things are lawful, that we're able to do these. And my understanding is that we can. I don't want anybody to feel uncomfortable about the way that we collect the random names. And then what I'd like to do also is have 2 potential people for every spot that's chosen, so that those people are matched in terms of risk rates, demographics, and various other parameters, so that in the event a person decides they don't want to be involved in the study, that we can replace them with a person who we assess to have a similar probability, be of similar demographics and description, so that that we can keep things randomized. Even in the event that that we don't get full cooperation, which I expect we won't get full cooperation from everybody who's tested, to choose a 58-year-old man, and when he decides he doesn't want to be a member of the study, instead replace him with a 13-year-old girl is probably not a great way to go about doing things. We want to make sure that we can truly randomize things and account for the fact that some people won't want to participate.
Makes sense. Thanks.
Sheriff Fallon, do you have any questions?
Yes, I do. Thank you, Mr. Chair. Dr. Stringham, is what I'm going to shift gears just a little bit, but how long do you anticipate the contact tracing to occur?
The contact tracing in terms of, I'm sorry, I didn't.
Okay, so our people who we have working on contact tracing, how long do you anticipate that to go on?
So we have a couple of different people who are working full-time at this point, and one additional person who's working part-time. And I don't know. I think that it's kind of an ongoing question. And I would say that a reasonable way for us to make the decision would be to wait probably for another week and see what happens to our data. And I think we may be able to pull back on 1 or possibly 2 positions also. I'd like to have at least one person who's capable of looking at the data and doing the various contact tracings. And the reason is because when we did this, the state decided to pull back. They were very happy with the way we were collecting data, et cetera. So there'd be a short time that would be required in the event that the state took back over. I'd want to give them enough time in order to be able to do that. I also think that our team has done such a great job, and the data that we've collected, I think, has been partially responsible for the low numbers that we see. And so my preference would be to keep at least one person working, and we could potentially alternate that back and forth. So I know that both of the law enforcement agencies, Sheriff's Office and Winnemucca Police Department, have been very, very generous in donating the services of the people who are making this possible. And I realize that both agencies are going to need to have some answers in terms of how long this will go on for. And I think we can probably give you an answer at some point during the next several days, depending on the number of cases that we see. Does that answer your question?
Yes, it does. Thank you.
Thank you.
Do we have any other questions? Hearing none, we'll move on to Captain Wilken. Give us your report from.
Morning, Commissioners. So it's always hard following up Dr. Stringham because he's a wealth of information on what's going on with our managing COVID virus and in the community. So thank you to Dr. Stringham. I want to give a very sincere thanks to the Nevada National Guard and all of the resources they sent us out for the community-based testing, the support we received from HGH, Dr. Stringham, Humboldt County, from Kim and everybody down there at the event center. We could have asked for more support from everyone, so it was greatly appreciated. The event was a huge success. We received a lot of positive feedback from the community for bringing the testing here. It was entirely voluntary, and I think it gave people a lot of peace of mind. I think seeing numbers that are close to 1/100% of the people that were tested, only that proportion being positive, that's a good thing for our community. And I think it gave a lot of reassurance to people in our community that, we are starting the downturn of this. And it gave a lot of reassurance to us that are working to manage this issue that we're moving in the right direction and hopefully getting the right information out to the public. At this time, all of our resource requests through Nevada Department of Emergency Management have been filled. I just received a delivery of another 4,500 masks for county and government employees in our community this morning, and we're working on going forward. They are changing on resource requests. We do have to provide a burn rate calculator with the RRFs that are submitted to Nevada DEM. So the individual agencies that are submitting the RRFs back to me, which is a request for resources, need to submit that CDC burn rate calculator with their PPE. So for anybody that's on the board or on the call that does submit those requests to me, I do have to have that documentation in order to submit your request for you. Moving forward, it's the management of the incident is starting to scale back. We're seeing a reduction in the quantity of conference calls and state level meetings that we're participating in. We're still participating in everything that's there, but they're bringing the number of those meetings back. So instead of 7 days a week, we're down to 3 days a week on our state conference calls, and everybody's been working together. I spoke with emergency managers from Lyon County and down in the Quad Counties areas. We're following and working in that same path that we are. Elko's emergency management and Battle Mountain's emergency management reached out to us after the community-based testing, and they're going to follow the same model that we did here for our community-based testing in both Lander and Elko counties. So I think that we set a good example for other communities along the I-80 corridor, and I'm glad to see that because there's so much overlap in our communities with the mining industries and people who work at different mines in different areas. So I think as that goes on, we're going to get a really good idea of kind of a whole community approach between the 3 and 4 counties that are along this area and have a really good idea of how this virus is actually impacting our communities. So demobilization of the hospital, Dr. Stringham already spoke to that. We did take down the offsite hospital. We pulled back our command center and our other resources in that hospital as well. And we're just moving forward with day-to-day management at this point on the emergency management side.
Thank you, Captain Wilken. Do we have any questions of Captain Wilken? Commissioner French?
Mr. Chairman, this is Commissioner French. Captain Wilken, I was just wondering if you had any information as to whether or not those counties that have zero or very, very low infection rates, that they are they planning in community-wide testing efforts as well, or are they passing on that?
I don't know the answer to that because they coordinate those efforts through the Guard directly. I can speak to Elko and Battle Mountain because Elko's emergency management reached out to us for some help and guidance of what we had done here, and the same with the LEPSI from Battle Mountain. The other counties, I don't know. We have a pretty well-developed emergency management program in these counties that are along here, so we all work really well. Some of the other counties, it's not quite the same, or they use different resources through either public health or their local hospitals. And so they're coordinating that directly with the state. So that I don't have an answer to.
And Elko is testing right now, I believe.
Yes, sir.
Thanks, Sean.
You're welcome.
Commissioner Bell, do you have any questions? Commissioner Brizendine?
No questions, Sean. I just want to thank you very much for setting all of that up. It was a very positive experience. I mean, the nasal swab was not all that much fun, but the way that it was organized and structured, I was very impressed, and I was really happy to see how many people actually showed up. So thank you for what you've done. And another little FYI that I heard the other day is that Walmart, if anybody needs masks in bulk, Walmart sells them 30 masks for $50. So I don't, it still sounds a little high, but at least they are available, and Inland Supply, I believe, has them as well. So thank you.
You're welcome. And just some feedback on that on the pricing. Most of the wholesale companies on true KN95 or N95 masks, they're selling those at a rate of between $4.30 to $4.75 per mask.
Wow.
So that actually isn't bad pricing from Walmart.
Okay, good to know. Thank you.
Okay, I'm sure if the sheriff has questions, he's already asked them of the captain.
Mr. Chair?
Yes, Mr. Mendiola, go ahead.
Yeah, I just wanted to kind of add on to what Captain Wilkin mentioned. So when the guard came in to do the testing, one of the things I forgot to mention is that, they get a pittance for a stipend in terms of food when they come in here for these things. So I reached out to the Boys and Girls Club, and they provided lunch for 3 of the 4 days that they were engaged here in town. And I want to thank Chad Peters for that. I think he also reached out to some of his partners that do a lot of funding of the Boys and Girls Club, but they provided, I think it was about 50 meals every day for those 3 days for the group that was out there. And then also Spare Time Bowl, they came through on the first night, Thursday night. They provided a bunch of pizzas for the group out there. So I just, my thanks go out to those guys. And that's the Peters family in general, Eric Peters and Jessel.
And if I can add on to that, Walmart did lunch for the Guard soldiers for the first day that they were here, and that was donated. And when I reached out to them, they're more than happy to help us. And I want to thank them as a community partner for same thing. And speaking with their command staff that was here, they went to a lot of our local restaurants to eat in their off time. A couple things here and there the first day or two that they were here when they were setting up. And they said that the service they received and the welcome that they got from our community, and this is from their 2 lieutenants who were in charge, was absolutely excellent. And they felt like they were welcomed here with open arms. And I think that really reflects well on Winnemucca and Humboldt County as a whole. And I was very appreciative to hear that on how these troops are treated coming up here to help out our community. They praised us a lot here, and that's good to know.
Do we have any other questions of Captain Wilkin? Hearing none, we'll move on to our Public Information Officer, Nicole Maher. Nicole, do you have a report for us today? Are you on, Nicole?
I believe she is on. I'll double check here. And she should be mic'd up. Looks like you're unmuted, so.
Can you hear me okay?
Oh, there you are. Yes, we can hear you. Good morning. Now we can't.
We lost you, Nicole.
I'm sorry. Can you hear me now?
Yes.
There you go.
Okay, I will try to speak up. Appreciate the information from Dr. Stringham and Captain Wilkin. I just wanted to make one clarification that not anything they said, just out in our general information that's going about the community. As both have mentioned, we had just the one positive confirmation through the community-based testing, and people continue to wonder if we actually are at 79 cases because of that. And no, I just wanted to clarify that that one case from the community-based testing is part of our 78 number, and so that is our total number of cases right now. I wanted to address mask wearing in general. Just we have seen a real division among our community. It's wearing masks has become both symbolic and inflammatory in our community, especially over the past few weeks. On one side are people who believe that wearing a mask is an appropriate health choice for them and their family. And for others, it goes beyond personal health to even becoming an ethical or a moral choice to help protect others. As one person wrote, masks help prevent others from being infected with the coronavirus, including by people who show no symptoms. So wearing a mask is the right thing to do to protect others. And on the other side are those who feel that wearing masks is an infringement on their own freedoms. And for them, perhaps not wearing a mask is symbolic of their belief that government can't tell them what to do. Well, this week we shared information that I shared with you last week about some posters that are going out to local businesses, and it sure has created a bit of a bonfire. The posters, just as a reminder, we're asking local businesses to share their willingness to abide by three things. One, to require employees to wear face coverings. Two, to require employees and customers to socially distance. And three, to require employees to frequently wash their hands. And the poster does not state that customers are required to wear face coverings. However, several commenters have stated that they would be unwilling to patronize a business that requires face coverings. Some have referenced what they call our fear campaign to address a virus they don't believe has the potential to truly harm our community. And as one person put it, don't take my freedom from me because you're scared. Some have offered a counter argument to that they themselves would not patronize a business that doesn't have the greater good in mind. And so it's been an interesting contrast in our community. Certainly, as we know, we recommend, and we're seeing some of those posters come up around businesses. We recommend that everybody wear face coverings for both personal protection and also but mostly to protect others. As we have found out, some asymptomatic people are infectious and can spread that, and so wearing a face covering helps offer that protection. Another thing that has stood out this week is just confusion about local events. Residents are confused as to why some private local events that have been liberally advertised are taking place, seemingly without recommended prevention measures. And they wonder why such events are not being policed when businesses have not been allowed to open. And also when we know that many of our confirmations have come from people gathering in inappropriate ways. And so that has caused a lot of questions and a bit of conflict. There are some businesses doing certain things where people are not perhaps using the right protective measures, but it has caused some concern. And so it will be important as we move to this higher gathering rule of 50 rather than 10 to continue to offer recommendations from Dr. Stringham and from our state government as to what's appropriate and not appropriate. As we look to phase 2, there seems to be some overall excitement in our community about beginning phase 2. Some are excited to jump back in with 2 feet while others remain cautious. Again, completely fine. People are also excited to be able to enjoy parks and are looking forward to seeing recreational areas open again with the warmer weather. Has brought up a lot of questions in our community over the channels and to me personally about whether this is going to look seasonal or not. Are we going to be doing the same thing in the fall? Are we, by the time we get at Christmas, what will this look like? And And certainly we don't have all of those answers right now, but I think Dr. Stringham's counsel to us to continue our avoidance techniques is very important. One of the things that I've just shared with people is to personally think about what you've learned, what you still need to learn, how you've prepared, and what you still need to do to prepare. I wanted to just touch on our seniors for a minute. Patty at our Pleasant Center is just a wonderful ambassador for our seniors in the community, and they continue to do homebound meals. And if I'm correct, they're up over 70 now and doing those meals, and that is quite a feat every single day. We continue to share. We continue to share a weekly newsletter with the seniors, and it looks like the Pleasant Center will not open until July at least. And so continuing to give good information to our elderly population is important. One of the things that I am working on in concert with Dave Mendiola and Dr. Stringham is just a list of frequently asked questions. We have a lot of questions about how do people get recovered, and Dr. Stringham spoke to that today. What about our FAST team, as the sheriff mentioned? Just questions that some of them are things that we just routinely discuss and we know the answers, but that doesn't mean our community does. So we'll be building on that list and offering that list in a place where people can easily access it, where we can continue to add to it. I just wanted to mention that we will have 2 community testing sites that still fall under the Humboldt County pod through Marcia Foreman, our community health nurse. So tomorrow and Saturday from 10 a.m. to 6 p.m., there will be testing at the Pershing County Community Center. And then on Monday, June 1st, there will be testing from 10 a.m. to 4 p.m. at the Pershing County Grass Valley Community Center. And any Humboldt County resident is welcome to go to those free testings, and their test will actually be ascribed to their community or their county of residence back to Humboldt if they are Humboldt County residents. So completely welcome to take part in that. And I also just wanted to mention on behalf of the mask makers that there is a stock of cloth masks at each of our pharmacies in town. And if people need a mask, they may stop by one of the pharmacies to pick those up. I know that I've gotten a few requests from churches as they think about opening up and concerned about having masks on hand for parishioners. And so that's something we need to consider as well, and how we make sure that that those folks are protected as they come back together. That's all I have. I'm happy to take any questions if you have any.
Commissioner French, do you have any questions?
I have none at this time. Thank you.
Commissioner President?
Nope, I have none at this time.
Commissioner Bell?
No, I don't have any at this time.
Sheriff Allen?
No, I don't have any either.
I guess you get lucky today, Nicole. We don't have any questions of you, but thank you for what you're doing. Any other questions from the public at this time? Okay, we'll move on to follow-up review and discussion regarding phase 1 of the opening of the economy. Discussion of possible action regarding the opening of non-essential businesses, which began May 9th, based on Governor Sisolak's announcement on phase 1 of the road to recovery. And we're going into phase 2 as of today, I think, yeah, today or tomorrow. It's today. The guidelines were issued the night before last, when we have some more coming out today or last night. So who wants to go with this?
Mr. Chair, Dave Mendiola. So I think the only thing I want to say is that you and I believe Commissioner French were on the call with the LEAP group yesterday. And of course, one of the things that's the governor has allowed here in phase 2 is some of the things that a lot of people have been waiting for, like gyms and salons and some different things like that. So, which is very exciting. I think a lot of these folks have been preparing for this day for a long time. There, as like anything, there's, I think, controversy, as Nicole referred to, as to how that should happen and what's right. And just one thing I wanted to mention is that, as we have discussed in the past here on this meeting, you know, the Board of Health and the Board of County Commissioners really have no authority to require a citizen to wear a mask out in public, to any facility or in general, just outside. I think there's a little bit of confusion out there because I've gotten several calls about that. And I just wanted to remind folks that we really can't require, of course, everybody, at least from this board, has recommended that people do that, and distancing and, you know, those types of things. So, and I think it's been very effective. And so I just want people to understand that, you know, as these openings start and outdoor events and things like that, I think that most everybody, based on the feedback that I got from the business opening reports that I got back from people, they are, you know, requesting that people wear masks when they come into their businesses. But again, they can't force them. And so for those individuals who don't want to do that, then they don't have to do that. And I just want to make that very clear. And I think a business can demand an individual wear a mask in their business environment should they choose to do that. But we as a county, we as the Board of Health, or you as the Board of Health, you really don't have that authority to do so. So I just wanted to make that reminder. I think the most important thing that came out of that meeting yesterday, Commissioner Tipton, is that, you know, we're all in this together. There was a question from one of the callers as to why, you know, some counties are having to follow all these rules when they've never even had a positive test. And you know, Commissioner Kirkpatrick from Clark County was eloquent and very clear and concise in her response. And that was, you know, they made the decision, they meaning the counties in Nevada, made the decision to go about this as a group, as one. You know, Clark County, which is kind of surprising when you think about it, they're, in terms of ratio, are probably the lowest infected area in our state. And yet, you know, they chose not to be treated independently, aside from somebody else, even though they had the most to lose. They chose to be part of all of us, and they didn't want to hold Humboldt County because they had a situation that was unusual. And so I think our job, in my opinion, this is just Dave Mendiola, citizen of Humboldt County, talking here, is to do the right things, just like Dr. Stringham mentioned, is we continue to do the right things. We can start to expand our lives, get out in the public. I really encourage that. You know, visit your restaurants, start doing those things. But where you can wear the mask, always distance. That's probably number one. And I would just request that people do that and think about that and remind that, you know, this is not the intent of stopping anybody's liberties or freedoms. It's just simply to say, hey, let's do the right thing. And if we do it for a short period of time, relatively speaking, you know, now it's been a couple months, maybe a couple more months, I think we're going to be in a completely different place. So I would just recommend that we all are in this with our brothers and sisters in other counties. And so let's not screw it up for the rest of the state. That's all I would like to ask.
Thank you, Mr. Mendiola. I thought that was very well said. Yeah, I thought that was a big part of our call yesterday. And I did have that question earlier on the community testing of 2% every month for a year. And I understand how that would be really important, but I hadn't heard that, how that's going to hand down yet. We probably will know more within the next week, and we'll be having more of those calls with the LEAP group as we go forward. Anybody else have anything? Commissioner French, do you have anything from yesterday's call on phase 2 openings?
You know, I think I share the exact same feelings that Dave Mendiola just expressed, and did a very great job of it. The one thing that came back to me, though, was almost a pleading on the part of members of the team who have been negotiating on our behalf in terms of the criteria for reopening through phases 2, 3, and 4. And the one that really stuck to my mind was a comment that Commissioner Gogachia made to, I believe it was Commissioner Andriozzi from Elko, having to say, he was actually said, you know, he went to the mat and negotiated and justified phase 2 opening of the bars, having to do how that with the criteria having to do with how people step up to the bar and whatnot. And he pleaded with the members that were on this board that please don't make me look bad. I went to bat for you, and I was assuming at the time that all of us would understand why we're doing what we're doing, and please don't try to make a political statement using, for instance, the criteria having to do with the opening of bars. And I thought it was just a perfect statement with regard to the responsibility we're all carrying. And because we can make that political statement, and we may even believe that that this isn't what is being said it is. I personally believe it is, but you know, regardless of what our personal feelings are on it right now, we are in this together, and we are this. And the downside of this whole thing is that if we don't continue doing the right things, we're going to come out the other end of this with a potential of a spike and have to roll back our liberties once again. And I don't think anybody wants to see that happen. So I would just say, for the record, and for those folks that are on this call right now, is that we are in this as a community, and Humboldt County is a shining star within the state right now in terms of how we are responding to what we had of a significant outbreak. And I just want to make sure that we continue down that road and don't try to politicize this. So anyhow, thank you, Mr. Chairman.
Thank you. Anybody else want to weigh in on phase 2 reopening? Dr. Stringham, do you have anything on that?
No, I think that there have been some very, very nice comments that have been made. I've just been sitting here, kind of enjoying some of the viewpoints, and I think that we have a wonderful opportunity, and I feel very confident based on what we've seen over the last few weeks that people in our county are really doing a great job. That people are really taking this seriously. I completely agree that it's not a political process, and I think I speak for everybody on this board that I have absolutely no interest in controlling people. I don't think any of us do. In my own private life, I'm actually a very conservative, live and let live type of a person. It's not in my nature to tell people what to do. It's in my nature to tell people what I think is best to stay safe, because we care about them. And I think that the spirit in which our actions on this board are intended is to keep the residents of Humboldt County safe, not to cloister or to limit or to remove liberties or freedoms in any way, shape, or form. And so it's not political, it's about safety. So do the right things.
And Mr. Chairman, I have just one comment as far as not being able to enforce the masks. We may not be able to enforce the masks, but the leaders of our community need to be wearing them, and we need to be seen that we are wearing them and be good role models for this. That's my only comment.
Thank you, Commissioner Brizenden. Any other questions or comments considering phase 1 and phase 2 reopening?
Mr. Chair, this Commissioner Bell.
Yes,
Yeah,
sorry about that, Mike.
that's okay. Hey, this is having to do with the masks and whatnot, and I know that there's been a lot of discussion around that, and the N95s came up, and I guess what my question is, and this might be something for Dr. Stringham, is the N95s, from my understanding, you know, like when I work at the hospital and whatnot, we have to get fitted for those masks, and they're a droplet, and they're probably your more protective type of a mask, but they are so much more expensive. But you know, they're at the hospital. The N95s are only worn by those folks that are in the actual dealing with the patients that are actually have the virus and whatnot. And so I'm just wondering the wisdom in having the N95s instead of having just a cheaper mask like the one I wear when I'm around in the hospital and whatnot. I don't wear an N95, and we can get those so much more expensive. But is there a reason for that? I think maybe Dr. Stringham could answer that.
Yes, absolutely, Commissioner Bell. The comments that you made are correct, and I think that in the end, an N95 mask, as far as we know, is the absolute best mask, short of going to a rebreathing system where a person is encapsulated in a device like you might see in the movies. It's not actually a mask at all. It's an air filtration system, and but without going with anything quite that elaborate. In terms of masks alone, N95s are just as good as it gets. But as you've indicated, in order to be able to enjoy those benefits, the mask has to actually be fit. And the advantage to some of the lesser masks is that they don't have to be fit, largely because they don't have the efficiency necessary to make that fitting necessary. And so I think the reason that we're using the homemade masks and some of the dust type masks and various other masks is because of the availability of N95s. And once N95s are more available, I think in the future, we likely will transition to mostly N95 masks. But when we do, in order to enjoy the full benefits of something that has that filtration capacity, it absolutely does have to be fit. You're probably better off wearing an N95 mask that doesn't fit quite as well as it could. It doesn't have a true N95 capacity if it doesn't, but the overall system I think is likely better, and ideally everybody would do that. So I think for right now we use a lot of the other lesser types of masks in order to enjoy some of the benefits. And remember that there really are two different strategies that a mask uses. An N95 mask limits the capacity of that virus to get in and out of a person's respiratory system. So protects them, the user, and also those around them. The other types of masks, cloth masks, also do that to a certain extent, but largely what they're doing is limiting the droplet nucleus, the atomized saliva and other liquids that are leaving a person. They're slowing those things down, causing them to tumble, and where they're not completely limiting, they're lessening the probability that those viral particles will get to a further distance from that user.
Any other questions? I wanted to bring up that you can find out information about phase 2 openings and the things that need to happen for different businesses to open on the state website. I was looking for that in my notes. I don't have it. Do you happen to have it, Commissioner French or Mr. Mendiola?
I don't have that readily available. What we will do though is we will be adding that to the hcnv.us website, and so along with all the other COVID information, we'll update that here in the next hour.
Perfect. Thank you. No other questions on this item. We'll go to future agenda items and next meeting. I have down for the next meeting next Thursday at 9 o'clock. Any other agenda items than what we normally have? Is there anyone that would like to add something to that agenda for next week's meeting?
Mr. Chair, Dave Mendiola, So I will add the antibody testing update. Dr. Streamman gave a good overview of that, but I'll just add a line item specifically for us to follow up on that. And then also, we did come up with the question about the ongoing community testing plan that came up in the LEAP meeting yesterday. And so I'll just put that under testing generally, and we can talk about both if we have some more information on that as well. Those are the two things that I have.
I think we should put in there an item for opening county offices.
And we can do that. Yep.
There was another one.
Mr. Chairman, this is
Yeah.
Commissioner French. I had one, I'm not sure if this is an update or whether this is something we can include for today's meeting, but had to do with a question we had last week with regard to the order of cloth masks for the general public that Humboldt County had made. I know David mentioned that there were 3,000 masks on order and they were expecting them the following week. I was wondering what the disposition of that was. And if they have arrived already, I'm wondering if how we can distribute those as the Mucka mask makers have done to try to get them out to the public. Thank you.
Mr. Chair, I can give an update on that. So we had two vendors that we were working with that came off the preferred vendor list from the state. And unfortunately, none of those vendors ever got back to us. They never placed the orders. So I did hear great information about Walmart this morning. So we're on the phone with them right now, as a matter of fact, trying to get those ordered and see when we can get them in. I can give you an update certainly next week, but hopefully they've got those readily available, or more so available than the luck we've had so far. So it has not been a very good process.
I think
Great, thank you.
Mr. Mendiola, I think we need to change the agenda item 2 from phase 1 road to recover to phase 2.
Right, and I will do that. We didn't know that before we had to post this, so.
Right, and I would like to just put out there that in our meeting yesterday, they're hoping that phase 2 can be like phase 1 and be maybe 2 to 3 weeks, and we can maybe move into a phase 3. So if we can continue to do the right things and make the gains that we've made within the state, we should be able to move closer to a full opening.
And Mr. Chair, this is Commissioner Brissenden. The information that you were asking about where to find about phase 2 is nvhealthresponse.nv.gov. So NV being Nevada, all one word, healthresponse.nv.gov will give you all of that information.
Thank you, Commissioner Brissenden. And Mr. Mendiola indicated he will be putting that on the county website as well, so that's good. If we don't have any other future agenda items to put out there, let's move to public comment. If you have a comment from the public, go ahead and speak up, unmute your mic, *6, give us your name, and we'd hear from you now. Any public comment?
Can you hear me? This is Paige Brooks.
Yes, we can, Paige. Go ahead.
Hey, I just wanted to give you guys an update for the city. The city and the chamber, along with some other organizations, are getting together and going around to businesses and showing people what it looks like open, what their restrictions are, trying to help small businesses along with just making you comfortable entering, and the sanitation that's going on, just to help our small businesses know that we acknowledge all the hard work they're doing along with city and county. So you might get calls on that to join in on some of that. The other thing is just an update, like from my small business, people are comfortable. Everybody's willing to do the right thing, whatever the requirement is. The other thing is that we're busy. We're very busy.
Perfect.
So I think the fear is lessening, and I think people are seeing us do the right thing, and they're doing the right thing. So I think in general, things are going very well.
Thank you, Paige. Do we have any other public comment? If you're trying to get on, unmute your mic. That is *6 on your phone.
Commissioner Forrest Newton here.
Yes, go ahead, Forrest.
Yes, I just wanted to say thank you to all you folks, the county commission, Nicole, Dr. Stringham, all those, the officers, all you guys are doing, much, much appreciated. You're putting a lot of hours in. I know you are, probably some money out of your own pockets. And this is quite a problem for the entire world. And I think the fact that our county, so many people are cooperating, and I agree with Nicole. I too have heard things about, the controversy about the mask, which I think is very sad. But I just want to tell you thank you. I hear a lot of people appreciating what you guys are doing. I want to let you know that.
Thank you, Forrest.
Thank you, Forrest.
Is there any other public comment? We don't want to leave anybody out. So if you want to make a public comment, *6 to unmute your mic on your phone and state your name. Public comment? Any other public comment? Hearing none, I will adjourn this meeting of the Humboldt County Health Board at 10:16 a.m. Thank you, everybody.
Thank you.
Thank you.
Thank you.
Hey, Dave,